Hi everyone, I am Pallavi. I'm a lifestyle and corporate influencer, and today I have with me Dr. Ranjan Shetty, who is the lead consultant cardiologist, and he's also the medical director at SPARSH Group of Hospitals. Doctor, it's such a privilege to have you with me today.
Thank you, Pallavi. Thank you.
So to begin this podcast, we want to focus more on World Heart Day, which is round the corner, and the theme for this year, 2025 World Heart Day, is Don't Miss a Beat. And well, to emphasize on this is specifically because loved ones around the world are missing out on time that they should ideally be spending with their close ones because of early CVD related deaths. So doctor, my first question for you would be, heart related diseases, is this still considered to be a middle age problem, or is this concept outdated?
I think, Pallavi, you have asked a very important right question. So we need to slightly go back. On a lighter note, the age is defined by your age plus 10. So when you say middle age, I'm sure different people are taking it in a different way.
Right.
But yes, no age is immune from heart disease. That's the message we need to take. Just because somebody is 30, 35, 25 doesn't mean they're immune. Mm-hmm. The youngest heart attack I have treated myself is 21 years old.
Oh my God.
Because this, so it can occur at any age. It can occur to male, it can occur to female. The real question which we are worried is that why is heart disease so prevalent in young people in India?
Right.
You look at the Western world, it occurs after 65, after 75. Women after 75, men after 65. But in India, it occurs much early. At least 2 decades earlier. So, men would get at 35 and women would get at 45. 2 decades earlier. The real reason is, this is what we know, is clustering of risk factor. In India, the problem is people could be, this very person who is hypertensive is also diabetic, is also inactive, is also eating a lot of carb, and is also maybe smoking, and who is not really bothered about his lipids, really bothered about his BP. So this clustering risk factor leads to a compounding effect.
Got it.
So whenever there are 2 risk factors, it's not 1 plus 1 becoming 2, but it is becoming
Cluster
8,
effect.
it may be 16. So imagine the risk it produces. As a race, we are like all or none. Either I want to be completely healthy, which is less than 1% of our population, or we are okay. Right.
So when we talk about Indian population being at a higher risk than the Western population, do you focus on the fact that is it lifestyle or is it genetics that plays the major role?
Yeah. This is again, this is a question which is very, very important, because genes are blamed for everything and people this. What I always quote this study, there's a study called InterHeart study, which studied risk factor across the world. Okay, and they came up with 9 risk factors which are responsible for heart attack. Although Indians get 20 years early, it was still these 9 risk factors which were responsible. So genetic itself is less than 10% responsible for heart problem. 90% is you.
So we can't blame our genes. It is on us. We have to take the responsibility.
We have to take the responsibility. And the other way what we say is genes are like loaded gun. The trigger is still with you. So even if you have a genetic,
you can change it, even if you're genetically.
Yeah, you could at least not pull the trigger. Once you know that yes, my young cousins are having heart attack, you stop smoking.
Got it. And maybe you get it earlier you go and you get yourself checked.
Absolutely, you got it right, Pallavi.
Right. So when we talk about younger people, like you mentioned rightly, that there is no age, like middle age, what is the middle age?
Yeah.
But right now, I have even read news of school kids getting cardiac arrest and death due to that, and I think they didn't even have an early symptom because it just happened and they didn't even have a time to work on it. So did they actually lose a specific time where they had some symptom which they did not read it correctly?
Okay, I understand your questions very well, but just to understand the disease itself, whenever you have a sudden cardiac arrest, unconsciousness less than 35 years, usually it is not heart attack. It can still be heart attack, but more likely causes is what is known as a HCM, hypertrophic cardiomyopathy, ERVDs. There are other rhythm problems. So you have seen footballers collapse, even in Western world. Some with ICD, shocked and get up. You will see all these in net now. So these are more common. But more than 35 years, when they collapse, 80% of that is because of a heart attack. Collapsing for I don't know whether 35 is middle age or young age, but above 35 when people collapse, you have to assume that it is heart attack. But when children collapse, it may or may not be heart attack. And generally they're all mixed. You know, people think heart is one disease, but there are many diseases when it comes to heart. But children per se, I would actually, in my mind, my list of differentials are different for children.
Okay. And what is the youngest age that a person should, start taking care of the heart health seriously, maybe go and get diagnosis done? Even if they don't have a family history.
I think it's a very valid question. So when you look for heart disease, you're actually looking for those 9 risk factors which we already discussed.
May we know what are the top factors?
We'll discuss. I mean, this is what I want to say. Less than 35 or less than 40 when people have heart attack, 90% of that is because of smoking. 90%.
Oh.
So if youngsters stop smoking, you could prevent heart attack by 90%.
Right.
I can't say the same thing for old people because there are other risk factors.
Right.
So I think the one key message should be smoking. Second is obviously genetic. Now time to test, it's depending on risk factor. One risk factor is sugar. The recommendation for Indians is at 30 you get your sugar test. But if you're obese, if you have a family history, do it earlier.
Okay.
Cholesterol you check at 21 because almost all the cholesterol in the blood is genetic. It's not really what you eat, unlike what what the
people
advertisements and the people think. It's really the genes and they code your cholesterol.
Okay.
So till there is a time you can change your genes, your cholesterol number is almost what it is. So that is at age of 21. Now, if somebody has a family history, 10 years early you start. Like father has at 55, you start at 45 at least. Most of the people with family history, now we recommend a CT angiogram. Because CT picks up the blocks at decades before.
Okay.
And that's really what we want to do. Pick up problem decades before, start the right medicine so that the disease never progresses.
Right. And doctor, as you mentioned, smoking is like 90% of it, which is the major bulk. Now, in the younger generation, they feel that if they occasionally smoke and even vaping that is used, I think vaping is more dangerous than smoke,
Absolutely. I think this is, if our podcast, that's one change in society, it should be this, that we should all be anti-smoking and there's absolutely no benefit. Yes, there is social pressure, yes, how people take, that's why when people like Pallavi tell that it's not cool to smoke, I think it makes more sense to you. You should follow that.
Thank you so much, doctor. And another question is, see, now I think moderation is the key. Like we are talking about smoking, drinking and lifestyle, sugar intake and all. We have also seen and heard that maybe in celebrities or even in sports people, like we mentioned about few people in the football or any, even I think MMA or something which is having direct physical combat. Do you think that taking steroids or these kind of supplements also might increase the chances?
Absolutely. All those anabolic steroids, what we call, obviously the drugs, which are definitely bad. Alcohol for Indian, any dose is bad.
Correct.
There was a concept earlier, French paradox we used to
wine
call.
Is good for
wine
heart.
Is good. No, for Indians, again, here the probably genes come in play.
Okay.
For Indians, any amount of alcohol is bad. So all these are bad. So is extreme lifestyle, extreme exercise. Yes, exercise is good for heart, but running marathon may not be. So moderation, I like that word which you used. Moderation is the key for everything in life.
Right. Because,
including food, including activity, including, that we keep telling that nothing is wish, nothing is amrut. It's the quantity which decides whether it becomes this or that.
Right. So we know that heart is a muscle, right? So what kind of activities or physical exercises should be done and how much?
Yes. So yes, exercise is must. For cardiac benefit, the recommendation is around 150 minutes of moderate exercise. So if I have to break it down, it would be 30 to 40 minutes of exercise where you jog, where you walk, where you cycle. and that's good enough. Beyond that, the benefit is not much. You might look better with more exercise.
So weight training versus cardiovascular activities.
Correct.
What do you
I think 2 days a week you must do weight training. 3 to 4 or more you should do cardio. It's must. That weight training need not be weight training. Again, not to bulk yourself up, but more to move all your joints. Doing something like yoga, meditation has added on benefit. Present generation need to manage their stress, because that's also important risk factor for this. Again, extreme exercise. So if you classify exercise between say 0 to 10, 0 being nothing, which our people are very good at, 10 means running marathons or climbing Everest.
And I think sorry to interrupt, doctor, I think what you're saying is aesthetics versus actually taking care of your health.
Absolutely. Right
because
point.
Even for bodybuilding, I think when people go extreme, although it's a very respectful sport, they don't drink water for the last 3-4 days. I think that's very, very scary, right? Absolutely. Dehydration might also trigger.
Yes. And I'm also against deadlifts, because some of them actually have it's called deadlift for a reason. So we need to understand. So just coming back to the grading of exercise, 0 which is nothing, 10 which is extreme, 1 is the best. Do something versus nothing. Maybe do 2. So the second message, if people have to take, do something. Every day have 30 minutes. Every day 1 hour. However busy you are.
Consistency,
try to take it to yourself. And yes, you don't want to do 7 days, do 4 days, do 5 days. And if you can always warm up, always cool down.
Correct.
This is the other message which we need to give people, because above 35 itself, people could have 10% block. So anybody who starts exercising, just maybe listening to this, they get very excited. It's still very important for them to have 10 minutes warm up, 10 minutes cool down, 20 minutes exercise. Very good.
True. I think to stress on this point, there are many cases that come up, not only in India, even in Western society, that they train, they work out, and they just don't do a cool down stretch. They go and take a cold shower, and they just collapse.
And the other thing what happens is, when you take a break, you've taken a vacation, you come back and suddenly
you think that your body is same as what it was earlier.
Don't do that. Do not have short-term goals like friends, marriage and parties and things. Only have long-term goals when it comes to exercise.
Right. So we have spoken about exercise, we have spoken about food habits. Now when we talk about sleep, I think sleep is something which is actually not given that much focus, but it's very important, right? Having at least 7 hours of sleep.
I cannot agree more with you. So when it comes to sleep, again, people just concentrate on the hours. That may not be the only criteria for sleep. Sleep has quality, sleep has quantity, sleep has predictability. And there are a lot of other factors. I think present generation, the key thing is to 1 hour before sleeping, one has what we call as a sleep hygiene. Sleep at a particular time, get up at a particular time. Don't confuse your body. That's this one. First time we got your cameraman's attention. So, so you have, complete, 1 hour before, no TV, no mobile. Read some book. That is the best. Beyond the age, just don't confuse your body. Stick to your routine. Then once you do that, also, caffeine and tea, just make sure, coffee has a half-life of 8 hours. And tea has half-life of 5 hours. So arrange it in such a way that it's not affecting your sleep quality or quantity. Then people think snoring is good. It's a sign of deep sleep. It's not true. Snoring is a part of disease called obstructive sleep apnea, where whenever they snore and choke, that's when they actually get up without knowing they get up. So there are multiple things in sleep, but yes, it has to be one of the priorities.
So if we have to key up as a sustainable society and also in a sustainable lifestyle, because stress cannot be completely eliminated. Sleep cycles also, with the kind of work deadlines people are having, even school kids have so much of stress, homeworks, that are assignments that are being given. What do you think are the key takeaways that the generation should take?
I think this, again, I like this question. So there are 5 things you could do to manage stress, because stress is part and parcel, and stress is internal. Stress is not the stimulus, it is your response to the stimulus.
Got it.
So you have to change. Stress can't change. So how do you change yourself so that you manage it better? One, the exercise helps. Once you do some sports or exercise, your stress level comes out. Adding yoga, meditation to your regime again helps in stress. Having good sleep hygiene works. Taking break from your work, traveling somewhere works. You know, once you do all this, it's okay to go up and down because they are also mediators. It's like fever. People are not acting with stress. There's something happening in their mind which is resetting. So it's your job to reset it again using this natural 4 or 5 things which we discussed, and doing what you like, doing what makes you happy, and not just getting burnt out. All this have their positive impact on your health. And as you know, the scientific fact also is that if you do all this, it's equal to one drug you could take for your mood stabilization. So yes, we should do that. This works as good as anything for managing stress and managing mood. Stress does have effect on heart. Acute stress, like you see in movie, produces acute problems like heart attack. Chronic stress lead to diseases like diabetes, obesity, and other things.
Yeah. So another question is, I think the increase of consumption of Diet Coke and Black Pepsi, which I'm also guilty of, but people say that if you have too much of these sugar alternatives, is that also very dangerous thing?
Again, very good question. The frank answer to that is that we don't know it fully. But imagine somebody comes 20 years later and says that all that you drank is leading to cancer. What do? You can't take it out. I think
moderation is the key again.
You got it absolutely right. So there have been studies, you know, all these studies are like fashion. It keeps changing, so frequent that you just have to follow. What I would advise is moderation. Don't do anything of too much. Don't avoid anything completely. Don't regret avoiding it. Don't regret taking too much.
Thank you so much, doctor. It was amazing to have you here and also to share the key insights that many people have the questions. You answered them so amazingly, and also something which we can actually follow up. And now, to end the discussion, what are the key takeaways for the young listeners over here?
So in a Gen Z way, if I have to tell, it's not cool to smoke. That's the first thing I would say. Exercise. Do something versus do nothing. Prioritize yourself. Prioritize your body. Money is just one aspect of life. You have to live in this body forever. So exercise, sleep, managing stress, absolutely no smoking. I think it's if you do all this, again there is a compounding good effect. We spoke about compounding bad effect, but there are also synergies of having good lifestyle.
Thank you so much, doctor. It was amazing to have you. Thank you so much.
Thank you, Pallavi. Thank you.